Ragadirogam satatanushaktam aseshakayan prasutan aseshan Autsutya mohan ratidan jaganam yo purva vaijaya namostu tasmai. This is the starting sloka of the Vagbhata. When we see this, a person who is without any raga, dvesha, asuya, madamatsarya, arished varga, such sort of the persons are asked to be, are said to be the Vaidya, those who are capable of treating the patient without any bias. The Raga Dirogan, the Adivaidya is the Paramashiva. Lord Shiva is going to be bless us in this regard. When we are looking at the Ayurveda, as today's is the Technoayurveda Panchakarma, is an ice-breaking session, and every Saturday 6:30 on 6:30 we are going to meet for 1 hour regarding the different aspects of the Panchakarma, which will be announced in advance. Dhatu Swamya Kriya Choktaha Tantrasyascha Prayojanam. This is the first sentence which we are going to learn. Dhatu Swamya is the balance of the tissues. They are not speaking the Dosha Swamya. They are speaking the Dhatu Swamya. Why the tissues are being more emphasized to be balanced rather than that of the dosha. Dosha is going to have the imbalance. That is a very common thing always, all the time. The imbalance of the doshas, a reflection over the dhatu, it is going to be terminated as a disease or a vyadhi. Treatment or treatment, whatever we are thinking, the treatment is the balancing of the tissues or the dhatus. Some people, they discuss even the Tridhatu is being said, thereby the Vata Pitta Kapas are also to be balanced. Here, the Dhatu is the only Vata Pitta Kapha balancing, or the Dhatu is the Sapta Dhatu balancing, is a one part of the things which we are supposed to look forward and understand. We are going to study this science of Ayurveda in the three skandhas. Hetu skandha, linga skandha, aushadha skandha. Triskandham Ayurveda. Hetu skandha is the causative factors. Linga skandha is the lakshanas. Aushadha skandha is the medicine. This is what we have learned from the beginning in Ayurveda. Now the cause, karya, karana. Karana from the karya. Karya karana sambandhas also being very specifically established, and they were asked to discuss from the beginning, either in the Charaka Sutrasthana or in the Vagbhata or in the Susuta. Everywhere, every time, the Ayurveda starts with the Karya Karana Sambandha. While speaking the Karya Karana Sambandha, they speak the how the Hetu is going to cause a symptom, how a symptom is being developed through a cause, and how a symptom is to be treated with a particular medicine. The medicine, when we are going to say, the medicine is an entity which is to be consumable or even the non-consumable also to be said as an aushadha. By definition, the aushadha is going to be a consumable product which is going to be used accordingly. Rasa guna virya vipaka prabhavas which are going to be a characteristic of the aushadha which could be based upon the compositions. But the aushadha, when we are looking at, this aushadha are to be used for the treatment purposes. As today is an ice-breaking session for the Panchakarma, a conceptual analogy is going to be observed here and it is being projected. When we see this basic Ayurveda triology of the doshas, Vata Pitta Kapas, if you follow the Vagbhata Sutrasthana, first few lines, Initially, we do not have a understanding of what this sloka says and what the commentators are going to say. We are not going to read either the Arunadatta commentary or Sarvanga Sundari Vakya. Always, all the time, we are trying to go with a recitation how our teachers are teaching us. When our teachers are teaching, they also not having a proper direction of understanding. In very first commentary of the Arunadatta, it says the Samhita is to be studied for the three things which we have to make it out. The first one is the Patana. Patana is reading the Samhita. Second is the Ardhajnana. Ardhajnana is the understanding of the subject. Third is Anushtana. Anushtana is the practice. That means a study and an understanding. The understanding is going to including even the experimentation also. And not only reading, anything which we read is supposed to be understood, and understood is to be experimented. The experimented has to be practiced. Now, when this Patana, Anushtana, Patana, Ardhajnana, Anushtana triad is going to be made out, this triad of the things are related to that of the Hita Ahara, Ahita Ahara. Hita Vihara, Ahita Vihara. Hita Hita Viharas, which we are going to see here. Hita Hitam Sukham Dukham Ayastasya Hita Hitam. This is what we have learned. Most of the time, we recite these slokas without even understanding also. Whenever they are speaking, always I used to speak Ayurveda at the crossroads. Whether to go for the allopathy, whether to go for the Ayurveda. Here, the Ayurveda allopathy combination permutation gives the four roads. Previously, we are at the crossroads. We are at the junction, in fact. We are unable to understand the word Ardhajnana. Thereby, we are missing the information related regarding the Ayurveda. What this Hitahara Viharas, which we are going to see, are going to come across, are going to be said with the 5 stages of the total learning of the subject. When we are learning this subject, first is the Pada. Pada means the word. The word which we are understanding. Now say Vata is a word. The Vata word is to be understood with its Nirukta and Vigraha Vakya. When we are looking this Nirukta and Vigraha Vakyas are to be learned from Vagati Gandhana Yoha. Gati Gandhana are to be brought as here. What is the Gati and what is the Gandhana? A coarse perception we are made as the Gati is the momentum or movement, and the Gandhana is the perception of the knowledge or the perception of the Jnana. Now, these words together is going to have a Ardha, a meaning also. When we say the meaning which we have a different. Directly, it is being sometimes expressive. Sometimes when it is having a specificity, they are going to say a coded language. Many a times people, those who are writing the Samhita, they are using the coded language also. We have to understand a pada Sanskrit. Many a times the Sanskrit translation which is made by the experts of the Sanskrit is not relaying a medical meaning in it. We have to observe. A much long time already we have committed and come across, and we are having lots of the compilation. Nowadays, even I see many of the books on different subjects. Each and every author tried to attempt the subject, and he compiled and he tried to explain according to his level of understanding. Now the question is, how many authors are able to understand the pada with the nirukta and pada with the ardha, and thereby they have to make each and every pada and artha is supposed to have a utility. Whenever there is a small sloka, is having a chandas, anushtup chanda with 8 of the factorial and with the words of the maximum of a 15 to 20 words in a sloka, what this sloka is relaying. Are they just made the sloka without any specificity and casually, or is this sloka closing a particular factor, or the sentence is also to be understood? Sometimes even we have to relate the previous sloka and the next sloka also together. The each and every word which is used in the Samhitas are also having its meaning and utility, their prayojana and akshepa and parihara. These two words probably nobody is going to speak. Whenever there is a vata is there, vata word, nirukti we have understood. What is the ardha of the vata? What is the meaning of the vata? Gati Gandhana by nirukta, which we have seen. One is the momentum and second is the perception. Okay, this is the meaning. If it is, what is the utility of the momentum and what is the utility of the perception? How and where it is going to be get utilized is to be understood. Once we understand the utility, then we have to have the akshepa. The akshepa is said to be the complaint. The complaint we have to understand at each and every level. Each and every word is also going to. If what is the complaint with the reference to the word of the vata? Vata word is having the gati and gandhana. The gati nirodhata or gandhana nirodhata. It is going to be get obstructive or abhava. When it is not going to be there, it is not going to absorb or it is not going to relay any sort of the perception, or otherwise it is not able to move the objective. Both the things are going to be a complaint. A gati nirodhata of the vata is a akshepa. This has to give a parihara. What is this parihara? Parihara is immunity. What is, why the parihara? Parihara, we use the word as whenever there is a graha dosha parihara, dosha parihara is to be used. That the parihara is, we are using this word parihara in terms of the curative procedure. A curative procedure also immunity. What does this immunity mean? Immunity is going to be inserted for the respective element which is going to be developed. Now, when this immunity is going to be get developed, this word is going to be get complete. That means when we study each and every word of the Ayurveda with the pada, ardha, prayojana, akshepa, parihara, then we are going to have a perfect understanding of the Ayurveda. Many times we don't attempt for such things where these words are going to become a vakya, these vakyas are going to become a prakarana, the prakaranas are going to become the adhyayas, adhyayas are going to become the sthana, and many sthanas become the tantra, like Ayurveda Tantra. Charaka Samhita is one tantram, Ayurveda Tantram with 8 sthanas and many chapters which are being. Here this Ayurveda, as already you know very well, does not speak, but as a in the breaking session of ice breaking session of this introduction, Kaya Balagrahodvanga Selyarusham. Why this 8? But we are studying today as on 14 subjects. Whether the 14 subjects embedded within, or does it require really to understand in this way as a Kaya Balagrahodvanga? At the time they have their classification. At present, we have our own classification. This is what we, but no. The question is here, the Kaya is the body. The body with the mind, always we have to make it out. When we are looking at the doshas, Vayu Pittan Kafascheti, Trayo Dosha Samasataha. The sentence of the Tridosha, as you see in the Vagbhata, at the very first chapter, he says, there are only 4 things to observe by a person who practices Ayurveda. Now, the Ayurveda practice when we are making, the Ayurveda is with the Kaya Chikitsa predominancy, Kaya Chikitsa embedded with the Panchakarma, because the Brahmana Chikitsa and the Landhana Chikitsa, both the things when we are going to see, the Brahmana Chikitsa is the nourishment or the nutritional supplementations or the supplementation therapies, And the Langana Chikitsa, always we have to consider it as a Sodhana Chikitsa. The Sodhana Chikitsa is otherwise termed as a Panchakarma. Janaka says Chatush Prakara Samsuddhi, there are only 4 types. But when you are looking at, as I move almost all the India, each and every area is having a dialect of the Panchakarma. People project the Keralayan Panchakarma. Keralian Panchakarma is deferred, or they are going to practice only the Vagbhata Panchakarma, but they have the Dhara Kalpa as a separate one, and that is being developed in the particular provision, thereby they project it as a Keralian Panchakarma. But the same way, it can be said as a Gujarati Panchakarma, Odia Panchakarma, Madhya Pradesh Panchakarma. Each and every area is having its speciality and dialection. These dialective Panchakarmas were not brought together at any time. I was really fascinated to see in a Barampuram. Barampuram is a district of the Odisha, Ganjam district, and from there, there was one specific stick massage therapy is going to be there. What they use is skin, the leather, thick leather, which is going to be there, and a small, this much of cricket, not the cricket, this what you call the round ball is going to be the bat, which is there. Like that, there will be a round stick is going to be there with a 3 to 4 inches of the diameter. And this is being kept in the one where the source of the fire, it is being inserted. When the stick is going to become hot, they dip this stick along with the skin of the goat or some other, and this is going to be handled with the massage. Very specifically, spinal massage and back massages, the people, those who are having the back pain for years together, with one single sitting of this stick massage of the Ganjam district or Bayampuram, is getting relief. This is what I have seen. What speciality they have is it is otherwise a pressure variations. That means ultimately we are drawing ourselves to a common phenomena to understand the Vata Pitta Kapha into triad of something different with the present day terminologies of the science, which we have to make it up. Before to going for the same, I would like to here bring into your notice what are the 4 things which are being said by the Vagbhata, a basic things to start with a treatment of a particular patient. How to understand these things? They are dosha, agni, koshta, and prakriti. It seems these words are very familiar to us and we know everything of it. The dosha, trayo dosha samasata. There was a question. Here the Rakta is said as a dosha by the Shushruta. One of the textbook in the commentary person, the author was incorporated as Ama as a dosha also. When this Ama dosha was said by the Vagbhata. Vagbhata referred as Ama dosha, but dosha trayam or trayo dosha, which we say Vayu Pittan Kapaschedi, trayo dosha samasataha, which is being said in that neither of the Rakta nor of the Ama is being brought. As there is a Sthana, Lakshana, and its even Karyas, the functions, and also the Vikaras, Chikitsa, the Rakta is being attributed. Surgically, when we are looking at the Susruta anticipating a Rakta or inclusion of the Rakta as a dosha is opt according. And one more thing when we have to observe, the Kaya Sampradaya, Shalya Sampradaya is the one thing which we are looking at. In spite of that, when I see the Hippocrates and the Charaka, in between is the Susruta. The Charaka concepts were refined by the Susruta and brought as the Rakta as the Chaturtha dosha, and the Hippocrates has taken these concepts of the Susruta further refined, and he brought the establishment of this entire new allopathic medicine. The story of this Hippocrates says he burnt his entire library after making his concept. He saved his book and rest of the books are being burnt. Why? Because he do not want to say to the people where from he got the idea even. This is what even we are looking. There are different scientific attitudes which we got. Zero is from the India, Bharat, and many things are from the Bharat. But in spite of that, even today we are just to speak about the people, those who are from the Western are the inventors and discoverers. But we have to prove ourselves who are our ancestors and what they have done with. They have brought many of the sciences like Bharadwaja Vaimanika Shastra and many more, which even we don't recollect the names also. Bharadwaja, as he is referred, Agastya is referred for the electricity, and the Baghdad battery, the model is being shown for the Ayurveda. The Bharadwaja, as referred with that of the flight engineer and a flight maker, the Agastya is the father of the electricity in India. We can just state the proofs are available, and what we see is we don't see it. We don't see our temples, our heritages on temple walls of the ancient. We see many of the things which are astonishing in nature. We just go with the Moolavirat and we just bell the mandir and we just say namaskara, I want this, I want this. We start giving our list of wants to the submit to the god. No, this is not the same. Vikrita avikritante deham grantite vartayanti cha. The doshas, vikrita avikrita is going to impact. That means the vata is going to be impactive over. This is one thing which we know. Vata, pitta, kapha are impactive. In what way they are impactive? Thus we anytime understand to say with its gunas or its lakshanas or its functions or its rest of the things which have been explained in Ayurveda. We do not make any such thing. Usually, this dosha referral to that of the Vata Pitta Kaphas, they are distributed in the body, but they are distributed in the body all the way. Whether it now the another question is going to come here, whether this Ayurveda which we are looking at gross Ayurveda. Did we made any attempt of the molecular Ayurveda or the electrolytes which we are looking as elemental Ayurveda? We speak about the Pancha Mahabhutas. We understand this Pancha Mahabhuta as we know it, but the fact is we do not know even what is Pancha Mahabhuta, what the Tanmatras can do. When we are looking at this Pancha Panchaka and Pancha Panchikarana Siddhanta, each and every Siddhanta opens a new dimensions to us. So we have to very specific to that of the Pada, Pada Ardha and Ardha Jnana and the Anushtana, ultimately the practice, and where we have to get a Prayojana and the immunity, that is otherwise, which we say a Parihara should be induced properly. Now, after the dosha, the Agni, commonly we are going to say the three varieties of the Agni. Vata is going to be making the Vishamagni, Pitta is with the Tikshnagni, Kapha with the Mandagni. I just have a question, why this Vata is going to make the Vishamagni? Vishamagni is made by the Vata because of its Yoga Vahitva. What is this Yoga Vahi? Once again, penetration into is the Yoga Vahitya. That means it can enter anywhere. What can enter anywhere is only a Panchabhautika Dravya cannot enter. If it is not Panchabhautikam, if it is at the Tanmatra level, then it can enter. Now the Vata is Amurtatvam. It do not have any physical substantiality. That means it is impulsive in nature. Any impulse can be entered in anywhere. When this entered in anywhere, thereby the problem of the Vishamata is going to be shown as oscillation in between the two different entities or the two extremities. Say, for example, what are these extremities? Temperature is an entity. The Ushna and Shita are the oscillations. When any entity is going to get oscillated, a substance, an impulse, when it is going to oscillate in between two extremities, then it is going to cause the Vishamata. And that is said as the Yogavahi. When this Pitta is with the Tikshna, this Pitta is with the Tikshna. Pittam Sasneha Tikshnoshnam Lagvisram Saramdravam. We know this sloka, but did we anytime implement what exactly it is to know? For a common understanding, when we are looking at the Pitta, there are the three varieties of the Pitta. When the first Pitta is the Pachaka Pitta, which is going to lay in the stomach or the Amashaya. The second is the Malarupa Pitta, which we call it as a bile. The Pachaka Pitta, we are making it as a HCl or the hydrochloric acid, which is produced in the stomach by the goblet of cells and acid productive cells, and Malarupa Pitta as the bile. And the third one is the Achapittam. Achapittam Udiryate. If you see this sloka, where this Achapitta is going to come is, the Achapitta is the third one, which is secreted from the pancreatic juice. Here we got the three things which are very important for that of the digestion. Pachaka Pitta, HCl or the content of the stomach. Second is the Malarupa Pitta, bile, content of the gallbladder. And the third is the pancreatic juice, which is said as the Achapitta. The three Pittas which we have to see together, it becomes the Tikshna, which is going to, Tishtatvam is going to assimilate. And if it is a Dvandaja, Kapha Pittaja, what it is going to have? It has to have the, according to the substance quantification. Here the mass is going to come. Now this Vata Pitta Kapha, when we are looking in another terminology, Vata is said to be related with that of the pressure and oscillation, and Pitta is with that of the energy and heat, and Kapha is going to be with reference to that of the mass and the gravity or the segregation. When this segregation is going to be seen, at that time, the Tishna Mandata is going to be oscillating once again. Sometimes the Kapha Pitta is going to become Manda, and Pitta is going to cause the Tishna. The Kapha Pitta causes the Tishna, and Manda is going to be get observed. These things are to be brought into the application in Panchakarma. Then only the Panchakarma is perfectly understood. Kapha as a Mandagni, and here the Vata Kapha is also going to be the Mandatvam only. That means either the Kapha or the Vata Kaphaja Yadis, both are turned with of the Mandagni only, always, all the time. This Mandagni has to be treated always, all the time, because Vata is referred to that of the neural disorder, Pitta is referred to that of enzymatic disorders or the disorders with that of the hormones, and Kapha is a tissue-bound or tissue metabolic disorders or Kapha disorders. Now, say when you are going to say with the Agni is we are limiting ourselves with only to that of the body. Whether this Pachakagni is the only Agni? No, even Dhattvagnis are there. Swasthanasya Kayagni Amsa Dhatu Samstita. This is the one sloka beautifully narrated in the Vagbhata. When the metabolic activity is going to be get increased, that is the Dhattvagni increases, there will be Dhatu Kshaya. And when the Dhatu activity, that the Dhattvagni activity is subsided, then the Dhatu Vruddhi. That means to increase the tissue bulk, we have to make the Dhatu Mandyata and the Jatragni Vruddhi for the assimilation. Vice versa, when we are having the bulkness, especially in the obesity, we have to make the Dhattvagni Vruddhi, not the Jatragni. Jatrag the Manjita we have to make and Dhatva Vriddhi we have to make, then the obesity can be there. This is a small concept which we have to understand. Third one is the postam. See, we do not require much bigger things to assess a Panchakarma patient and to opt a Panchakarma. I have developed a pulse diagnosis methodology which can take the individual physician directs himself to make a proper Panchakarma based upon the pulse diagnosis and the doshic profiles. This one is a great achievement what I could make out of my 40 years of the Ayurveda. The third one is the Koshta. How many of the people are going to understand this Koshta in reality? We know that Krura Koshta, Katina Koshta, Krura Koshta, Mrudu Koshta, and Majjama Koshta. Krura Koshta is the Katina, Mrudu Koshta is the Mardava, Majjama Koshta is of the medium. Vata Pitta Kaphas are going to be. Why the Vata is going to make the Krura Koshta? When we say Vata is there, Tatrastinistito Vayuhu Pittantu Svedaraktayo, this is the one statement, Kleshma Shesheshu is being stated. The other way, Pakvasaya is the sthana for the Vata. When we see the Vata sthanas, Pakvasaya is being made. That is the colon. Why the colon is going to be the primary placement of the Vata? Here the Vata, the colon, in the colon, what activity is going to occur is the first and foremost, the water reabsorption is going to be takes place from the colon. Calcium absorption is going to be there from the colon, and thereby these two things, ionic form which we see, the more and more absorption of the water from the koshta is going to give the dryness in the koshta. Thereby the Krura Koshta is going to be there. The Mrudu Koshta or the Mrudutva is going to be already Sasnehati Shnoshnam is being set for the Pittam. It is with the Sasneham. Any unction, whenever there is going to be in any form, all these unction subjects are going to give the Mrudu or the Mardavata. The Kapha, of course, when there is a lots of the secretory phases are going to be there of the either of the mucoid forms in the GIT, then it is going to be related with the Majjama Koshta. Majjama Koshta do not digest much and do not make out. That means it is a Manda Koshta, which we have to say. The Majjama Koshta is a Manda Koshta, Krura Koshta is a Katina Koshta, Mrudu Koshta is said to be the happening to be, we have to accept it as a correct one. Now, the fourth important thing which we are going to understand, the Prakriti. Once we say the Prakriti, yes, I know that I am the Vata Prakriti and he is of the Pitta Prakriti, patient is with the Dvandaja Prakriti. One thing keep in the mind, as per the Vagbhata, I am saying, it is written, whatever I am speaking, it is written in the Samhitas, very specifically in the Vagbhata first chapter. Dvandaja Prakritis are susceptible for that of the Vyadhi. If it is of the Vata Pitta or Pitta Kapha or Vata Kapha, any of the Dvandaja is always susceptible for that of the Vyadhi. Kevala Vata Prakriti means it is a Hina. And Kapha Prakriti is the Uttama Prakriti. Here the Hina Prakriti, Majjama Prakriti, Uttama Prakriti. Why the Vata Prakriti is a Hina Prakriti? The Prakriti is a Janmajata Prakriti of is being asked. Janmajata Prakriti and present Prakriti, both we have to observe. We have to, what does this mean is, this is otherwise, Prakriti is the Sarira Swarupam. The structure of the body is to be understood with. The structure includes the hair, etc. is being stated. But now, it is otherwise Apgar score, which we are going to measure at the time of the birth. A child, how he is active, how healthy we are active. Here in this, very specifically, a weight-related factors are going to be. A underweight child is a Vata Prakriti. A moderate child is the Pitta Prakriti. A heavy baby is said to be the Uttama Prakriti, the Kapha Prakriti. If a Uttama Prakriti person is going to be there, he is susceptible or he can accept some sort of things which we are inducing. A person Vata Prakriti, we who is already undernourished or malnourished or underweight, a child is not going to be, and he will be always going to be a hyperactive in nature. The Vata Prakriti person, because of his less weight and because of his less stability, he is going to be with the more unstable, and also more excitements are also going to be seen. Now, I do not want to repeat this, but I just want to state here for your references. Vata is said as a Ruksha, Laghu, Shita, Khara, Sushma, Chala. In this, how to attribute? Many a times we try to see this Vata as an entity. This Vata entity with the Ruksha. What is this Ruksha is? Unsticky. Otherwise, we have to say Ruksha is Asnigdha. Now, current is an impulse. Whether current is going to stick to a particular object? No. The same way, that means it is a conducted or conduction of an impulse is to be understood with here. Here the Rukshata is related to that of the conduction in the nerve, how a nerve conductivity is going to be seen with for an impulse of the nerve. The second is the Laghu. Laghu, it is said because the impulse do not have the any physical body, thereby it is totally light. When this lightness is going to be there, we can understand how this a nerve impulse could be attributed towards the Vata. Third is the Shita. Whether this impulse is a cold or hot. It is a cold. In hot, the impulse disappears. In hot condition, impulse is going to be disappears and disturbs. In the cold, impulse only can go into a particular wavelength. Otherwise, a hot climatic conditions or hot conditions are going to retard the or disturb the nerve impulse is to be understood. Any inflammation which is going to rise the local temperature, the local area nerve are going to be hyperexcited and the nerve impulse to the particular area is going to be get disturbed. Khara is a dry, Sukshma is a minuteness, Chala is always moving. Now see how beautifully we can attribute these words to related to that of the present say nerve impulse, which we know already their characteristics. The same way the Pitta and Kapha, you can just make it out. Yes, Pitta is referred to that of the bile and also the HCl together, which we are going to see. Even the Acha Pitta, which is secreted from the top of the pancreas, the pancreatic juice. That means pancreatic juice, bile, and gastric juice, three together is the Pitta when we say, then we can very comfortably draw a conclusion where exactly the problem is. Now, whenever the Pitta is going to be there is no need to worry and we have to make most of the things. A 50 ml or 30 ml of the ghee, when it is being consumed by, there will be a reflex action which is going to push the entire bile which is accumulated in the gallbladder, and all the bile evacuation is going to be done. That means Hasi Yasi Matra, which we are speaking in our Ayurveda, 24 ml, which is going to be, is the dosage to evacuate one bile evacuation. A 20 Hasi Yasi Matra, which is being stated in Ayurveda, it evacuates one gastric, one bile from that of the one bile evacuation or one evacuation of the gallbladder. Thereby, we can understand how Ayurveda is very precisely observed and being utilized. As the kapha, when we are going to say, most of the tissues which we are going to have, or wherever there is a fluid and water are going to be made out. Now, apart from this four of the Vagpata said, as the first is the dosha, second is the Agni, third is the Kota, and fourth is the Prakriti, Janmajata Prakriti, that at the time, whether he is a underweight or overweight. If we draw the Prakriti with reference to weight, then it and mass, then it will be very easy to draw a conclusion and which dosha nirharana has to be done in the Panchakarma. The Chatushprakara Samsuddhi, even there are more dialects in the Panchakarma, even there Agrikarma is there, Viddhakarma is there, and Sharakarma also is there in Ayurveda, which is being embedded. Now maybe distributed among the Panchakarma, Kaya Chikitsa and Shalya, etc. But all these Kriya Karma Chikitsa, a function, a Kriya which we are doing, a Kriya which is to be undertaken in Ayurveda with the Ayurvedic materials, they all are said to be the Panchakarma only, but we have limited ourselves. The Panchakarma means to only the five. As we can understand how these different things are going to be made out or to be diagnosed reference to of the Ayurveda Sampraptis. Even the Samprapti, when we are speaking, we are having many of the Samprapti Ghatakas which are brought by the enthusiastic authors. They basically Dosha, Dushya, Srota, Agni, and Ama. These five are the only components which are to be considered for the Samprapti Ghataka. With this, we can draw a conclusion of the disease state. But there are 10 factors which we need to examine for the Panchakarma very specifically when we are trying to do a Sodhana Kriya. As we have the first is the dosha, priority is the dosha, always the ultimate. Now, with respect to the Panchakarma, how we have to see the dosha? Here, the dosha is to be calculated with the pramana. How a pramana of the dosha is to be calculated? Dosha pramana, when we are making it out, always the sodhana is to be done for the whenever the dosha utklesha avastha is there. Utklesha avastha means from the dosha sthana when the dosha is getting the chuti or otherwise out of the shatkriya kalas, then the sthana chalanam is going to be there. Sanchaya, Prakopa, Prasara, Sthana Samshaya. In the Sthana Samshaya avastha, when it is going to reach, at that time we have to give the evacuation or the elimination or the shodhana or the langhana, whichever the term which we are going to use accordingly. Now the question is, what is that Utklesha avastha and how to understand this Utklesha avastha? Many people ask, sir, when we have to do the Vamana? Simple. If your patient comes to you with a sticky mouth and the stings of the saliva is there, when you are asking him to spit and the stings of the saliva is coming out his mouth, this is the Utklesha avastha of the kapha. Immediately, even without the sneha of the Vamana can be done. Because already kapha is the Utklesha. Why you want to make the Deepana, Pachana, and later on the Snehapana, and then the Vamana? This patient, when the Utklesha avastha, dosha pramana is more of the kapha dosha pramana is outreached, like the Yamuna in the Delhi right now, and it is flooding entire Delhi, and still you do not want to make any Langana Chikitsa of the kapha nirharana Chikitsa. What does it mean? Now the second is the Gati. Here the Sthana Chalana itself is a Gati. Apart from this, when the dosha is going to have the Gati Vyatiriktata, Vata is always to be downward. Vata is downward. Kapha is upward. Now, the Pitta is once again downward. If the Pitta is coming upward, if the Vata is coming upward, or the Kapha is going towards downward, at that time, immediately we have to choose the respective Kriya of the Panchika. That means, a Urdhva Gati of the Pitta is there. Immediately we have to give a Virechana. There we doesn't require to see whether the unction is there or not, because Pramana Vyatiriktata, Gati Vyatiriktata, or the Sthana Vyatiriktata. The Sthana Vyatiriktata is Pakvasaya Sthita Vata is coming into the Amashaya. Amashaya Pitta is going into the Pakvashaya. At the time also, we have to go immediately for the Panchakarma. Sodana Chikitsa, the Landana Chikitsa, Dosha Niraharana Chikitsa. So thereby the Panchakarma is to be defined a procedural part of the Ayurveda where the elimination of the excessive quantity deposited doshas or the humors in terms which we are considering are to be taken out of the body through the natural orifices by natural. We cannot just take through the syringe a vata, 5 ml quantity of the vata cannot be drawn. Or we cannot just draw the bile from the gallbladder and clean it. So we have to use a natural phenomenon, natural entities to eliminate the excess deposited in the body. The third is we have to observe the dushti prakara of the dosha. Which type of the dushti it is, whether it is sanchita dushti or the vruddha or otherwise the dushti kupita. We have the 4 varieties, even the kshina, vruddha or kupita. Here, kupita nirahartavya is the statement is of the sutra, which we have to understand. A dhatu asayata is another example where we have to opt the landhana or the panchakarma. Dhatu asayata, a vata is supposed to be there in the asti, tatrastin stito vayu. If the vata is going to come in the mamsa as the shleshma sthana, then also we require the panchakarma. If the vata is going to come into the mamsa sthana, there will be muscle excitation. Muscle is a kapasthana. Excitation of the kupita avastha, there the kupita kapha is there with the vata, or kupita vata is there with the prakrita kapha. We have to examine, thereby we have to make. Apart from that, we have to examine the which aushadhi termed in either Vamana or Vechana or the Basti areas, which of the medicines, because n number of the yogas are being given, and still, see how many people are being given with the, other than that of the Madana Phala, any Vamana karma has been done by anybody. Most of the time, the answer is no. Only we use the Madana Phala. Why? It is said as Sreshtam, but all the conditions are not to be used with the Kevala Madana Phala. It may give many a times, whenever we are doing the Panchakarma, we are losing the patient without any, or the patient is not responding for our Panchakarma is because we have chosen the wrong medicine for a right person, or a wrong medicine for a right patient. A right medicine for a right patient is going to give a perfect treatment. Many times I have seen the asthmatic patients are also being given the Madana Phala. No, the asthma or the respiratory kapha accumulations are to be removed with health things, and elsewhere body kapha is to be relieved with the Madana Phala. That we have to discuss in the forthcoming lectures. And the Desha, we have to make it out that the Bhumi Desha and Athura Desha. Now, a person who is living in London in a cold climate of the -degrees, -25 degrees centigrade, whether this person is to be given the Basti Karma or the Vamana Karma. How these climatic conditions, the climatic conditions are said to be, are referred to that of the Shitoshna Sthiti of the, see, in North India nowadays, we don't see the either the hot climate or otherwise the cold climate. We don't see the other one. There are 2, at the maximum 3. We don't see the Shadrutus, which have been classically being explained also. We have to check when it is going to come. Vasante Dichita Shleshma, this is what we have read. And in the Vasanta Rutu, you are not going to get the Nichita Shleshma. It is going to be a 15 days or prayer only. So always, all the time, we have to understand according to the climatic condition. Even in the Panchakarma, a common question which I faced for a long time is whether the AC rooms are to be suitable for that of the Panchakarma or not. Very simple. Anything. Here in Ayurveda, acclimatization is also one word which has come across. He is saying the controlled room. In a controlled room, when we are making the Vamana karma or Virechana karma or the Panchakarma, that means you are making a temperature regulated rooms. Always the Panchakarma is supposed to be done in the temperature regulated rooms. Well, that is the reason why they say after the Panchakarma, they have to wait and they have to come for the normal temperature whenever they are subjected for the sudation or otherwise the steam therapy or etc. or the Svedana. That means the Snehana karma can be in the controlled temperature room. You are making the AC room means 23 degrees, 22 degrees temperature is going to be get maintained. That is not at all a crime. Only the question is the AC rooms are going to draw the more of the moisture, thereby the person or the patient's water is also being pulled by the AC. That's what we have to see. It is otherwise is also one variety of the treatment which we have made it out of the six of the Brahmana, Langana, Rukshana, and here the Rukshana Kriya is going to be get obtained by that of the AC also, that will be understood. So here, after this climatic conditions, acclimatization or the regularization of the room temperatures are going to be done through AAC is not at all a problem, and it is being recommended also. And if at all the Vamana is being done, at the time even you can go for the 16 degrees temperature of the room temperature also. The fourth one is the Kala. Here the timing of the Panchakarma. There is a colloquially being said all the Vasti karmas, especially the Niruha Vastis, are to be given before to that of the sunrise. No. After the proper evacuations of the bowls, the Vasti karma has to be given. This is the statement. As in the Kerala, in the southern, people get up at the 4 o'clock and all the functions are going to be get completed by the daily residence completed by 5 o'clock. There by the 5 o'clock, they are having the Niruha Vasti. But a person who is in Delhi waking up at 9 o'clock, how come he is going to be given without any proper evacuation of the bowels a Niruha Vasti at 5 o'clock or 6 o'clock? And what does it give? It just takes out the stools of the, and it will be almost like a soap water enema, and thereby it is having no medicinal values, no Ayurvedic values. That is the reason why the Panchakarma is not getting a proper results in the present day by many of the people, those who are practicing. But we are practicing. That's true. Apart from that, we have to see for the Bala. Here, Bala is the Vyayama Shakti and Vyadi Shamatva Shakti. But I would like to bring in Abhyasa Bala. A Abhyasa Bala is, however, a strength which could be made according to the people, however they are going to be utilizing or accustomed with. Of course, Agni, Sattva. Sattva, when it is the psychological strength, Satya is as habitual, and Prakriti. Here the Vata Pitta Prakriti is always the Prakriti of the Deha, Prakriti of the Dosha, Prakriti of the Aushadhi, Prakriti of everything. Prakriti means it's the characteristics related to that of the other, however they are reciprocating, how to be observed. The Prakriti do not mean of the Vata Prakriti or the Pitta Prakriti. Whenever the Vata Prakriti of the dosha, when we are looking at, the Sharira could not be Vata Prakriti, it's of the Kapha Prakriti. Thereby, Sharira Prakriti versus the Roga Prakriti are being observed. And based on this Roga Prakriti and Sharira Prakriti, you have to decide the Aushadha Prakriti. This is the Prakriti which we have to have. And last one is Vayaha, for the proper dosage systems, which we are going to make it out. So, like this, when we are making it out, we have to observe. And next week, I would like to go with directly with this Sneha Karma, Abhyantara Snehapana. and we can discuss on the Abhyantara Snehapana with reference to that of the OPD level and also patients. If you have any questions, please do write to me, or you have my phone number, I believe. I can just say 9503227966. This number, you just send your query about this Snehapana. We are going to be discussing only this Snehapana next Saturday, 6:30. Thank you very much. If you have any questions, please come on.